So sometimes BIGO is covered or BIGO without just seed only, that's fine. But with BIGO BIGO is what? Ginkgo. So yeah, it covered a very hard shell. So you want to use it, you have to crack it down. Swanzarun too. Yeah, Swanzarun, even though it is small, it's not hard, but it's pretty hard. So you have to like crush it before you give it to the patient. Yeah, Taurun, Xingrun, Yirun, those Jiji, yeah, those things you better crush it and use it because better dissolve in the decoction and the better absorption. Okay, so that's most common herbs to use the different decoction method. So that's probably on the exam like one or two questions. So there's not that many information. It's good to memorize this. You already know most of them anyway. So just review, right? Second is for special dosage. So most of the herb dosage in general is between 6 to 12 grams, 6 to 9 or 9 to 12. But there's some herb has a little bit special dosage, and that's also commonly asked questions on the exam. So in the Chuanbeimu, between 1 to 1.5 gram as a powder. Most of the expensive herbs use the powder like a sanchi, those you use as a powder 1 to 1.5 gram. Genagin is a little bit more, but usually this 1.1 to 1.5 gram. Danshen, Danshen is a little bit larger dosage, but if you want to treat the vasculitis, you need about 60 gram of Danshen. That's on the exam often. Okay, so for vasculitis, how many doses you need of Danshen, right? So it's like that. So 60 gram. Guiz using for release exterior, like 6 grams like that. But if you want to use B syndrome, that means in that case, guiz is not used for release exterior, but rather it goes through the muscle layer and open the blockage there. So you need more dosage, 9 to 15 grams for B syndrome. Honghua, 0.9 to 1.5 gram harmonizing blood. When Honghua is used to invigorate the blood, you use like a 4.5 to 6 grams like that. Honghua is not using a large dosage though. But if you harmonize the blood, that means it's not the blood deficiency, it's not blood deficient heat, but due to those deficiency or excess, the blood tends to kind of bleeding or stagnated, like that. You add a little Honghua that kind of harmonize the blood. So blood is in comfort zone. So that's the use of Honghua. So very little dosage, 0.9 to 1.5 gram to harmonize the blood. Okay. And the Genagin, Genagin is used for the food stagnation and nutrition to the children. So this is what the chicken. This is a chicken, the sandbag. What do you call that? Gizzard, right? Thank you. This is pretty tasty one if you like it. But they use this function of the chicken eat those sand and all these things together with the grains, and they break down because there's some kind of a sand content inside. So that they use for this food stagnation for any kind. Especially gene is also as an animal product. They are used for the malnutrition of the children, and so they said this using as a powder is better than cooking with normal dosage of 6 grams like that. So there's a use of powder 1.5 to 3 grams as a powder as gene. And Maya is another like herb for the food stagnation. Do you remember Maya is good for what kind of food stagnation? Hmm? Maya is for grain, or like starch. But this is more like a grain, right? So, yeah, carb, right? So, alcohol and meat. Yeah, meat is more shanja. Shanja is more for the meat, and like alcohol mineral is for shenchu. So yeah, this all food stagnation herbs. So yeah, that's probably gonna go after that later. So yeah, Maya is used for inhibit lactation. If you use 6 grams, they inhibit the lactation. So yeah, all these ladies have too much of a breast milk. They want to stop milking. Then they have this Maya, and they like make as a belt to the breast to helping the stop lactation. So as the Maya 60 grams inhibit the lactation. Do you know what point is good for the stop lactation or inhibit lactation? Acupuncture point? Hmm? True, right? Yeah, close, very close. So yeah, it is a GB 37 and GB 41. Yeah. So anyway, this is stop lactation herb. And the Russian is in like a 6 to 12 gram range. But if there's hemorrhage shock, so that is like a faint due to like a heavy bleeding like that, use 630 gram, just cook itself, right? 30 gram. And raw ghee, 1.5 to 4.5 gram, starting with a 1.5 gram, a small dosage. And if there's no side effect, then increase the dosage to 4.5 gram. Shanjuyu, also 630 to 6 gram for shark. And the Wei Shan, 15 to 30 grams for fish bone. Interesting, but Wei Shan is used for like a B syndrome for all 12 channels, but they can be used for fish bone. And Jinchan Biowash is so most of the snake product is powder, so 1 to 1.5 gram powder. So as a powder, 1 to 1.5 gram is known. Just what this gene agent is a little bit larger dosage compared to the others. And dietary incompatibility. So Sungdi, Sudi, Heshou, those are strongly tonified in and blood. The pungent food like onion, garlic, radish is incompatible because they harm this like this moistening function of these herbs. They are too hot and the pungent. And Russian tea or turnip probably they gonna stimulate the urination. So Russian, when you take the Russian, be careful to taking tea or turnips. And the fulling is function is what? like the remove dampness, promote urination like that. The vinegar is astringent, so it works against. So yeah, this is a food incompatibility with the herbs. Okay. Any questions on this page? Next is herb with caution. Shangru, yeah, Shangru is this what you call summer mawang, right? Shangru is with this summer mawang. It looks like a mawang, and its function is more like working in the summer dampness, summer heat dampness. So, but if you take this Shangru in, if it's warm, then it may cause the vomit. So when you take the Shangru, you have to take it cool. So Shangru is vomit if taken hot. Okay. And Sungma. Sungma is the herb that raises qi. Okay. What are the herbs that can raise qi? Right, chaihu. So chaihu, sungma, qi, right? So this is typical raised qi herbs. Sometimes jigen also raise qi up to the lung. So yeah, sungma is raised qi. That you so when you like breathing difficulty, the lung chest go down, but it makes qi go up, so it make this condition worse. Or upper excess lower deficiency, like liver unrising caused by blood and insufficiency like that. So when qi is going up, you be careful on using sungma. Juemingzi is used for what? Clear the liver fire. But this is cold, and the Juemingzi many times we take as a tea as well too, because Juemingzi helps hypertension. So yeah, that taking Juemingzi overly, too much can cause diarrhea. Why that is probably working against hypertension because it's rather reduced, descending. Right? And Sengdi, pregnancy with blood deficiency, because this is kind of Sengdi is nourished in and cools the blood. So also they can nourish the blood, but this is cold with the pregnancy woman with blood deficiency, and add the Sengdi can cause too sticky, stagnated, so that has some side effects. So be careful when you prescribe the Sengdi blood substitute Sudi, because it's rather warm. Jichao is like a skin disease herbs with dampness, and measles, if skin disease on the superficial layer, but this one is working more like a deeper blood heat layer, then you better not take it because that is an aggravated condition because they're working on different level. And the Jin-In-Hua is used for toxic heat, right? Toxic heat or wind heat with toxic, the sore throat like that. So if the sore is due to qi deficiency, like what you call ins ulcer or inju, then yeah, this is like a contra. I mean, rather used as a opposite direction. So the skin problem due to heat or excess is different from skin problem due to qi or blood deficiency. So qi or blood deficiency or indeficiency sores is more flat and is rather deeply rooted, whereas Geninua type is like more exterior. Right? So you shouldn't mix with excess heat skin ulcer versus deficiency of skin ulcer. Qinghao is blood deficiency postpartum because too pungent, too dispersing. And Mutong is overdose may cause renal failure. And Mugua is a soury, and overdose damage the bone and the teeth. So, Mugua is good for the softening the tissue and bone. So, but overdose may damage the bone and the teeth. Bansha is very dry and warm. So if indeficiency cause bleeding, and this can make indeficiency worse, so you should avoid with the indeficiency bleeding. By chance, cough due to kidney not grasping the qi. This is kidney not grasping the qi means kidney yang deficiency causing the cough, and by chance is not like a kidney yang deficiency cough. Or by jeje, it's no topical for sensitive skin because by jeje is a little bit like pungent. So this is pretty spicy, tasty. So this may be very sensitive to the skin. Jiegeng, again, Jiegeng is hemoptysis, like coughing the blood. So that, because then this one, Jiegeng is going up, send the qi to the lung, so they can make this condition worse. So that you shouldn't use Jiegeng for hemoptysis. Xingren, this caution for infant and diarrhea. But Xingren is toxic a little bit, so you shouldn't overdose. Like a lot of herbs, the seed has some toxic. Xingren, baigo, like that. Chanja, because it's sour, is not beneficial for sour regurgitation. And so those is common contraindication cases to put against the herb. It says more, and kind of a. Maybe someone else. Let me see. Who's in here? Ruth May, can you read this page, please?
Hello?
This page, yes.
Okay, thank you. Let me see. I don't know how to zoom make it bigger. Let me see. This Google. Okay, I think I did. Okay, the current page, 5 or 6? Okay. Okay. Chen Pi, contraindication or warnings. Dry cough due to qi and yin deficiency. Hot phlegm, dry heat, cough, blood spitting. 父子 true heat, false cold. 人参 a hypertension patient over 180 systolic blood pressure. 大枣 dampness, food stagnation, parasites, phlegm. 鹿茸 slowly increase dosage. 五味子 may cause heartburn. 远志 careful when stomach ulcer or gastritis. 大黄 milking mom enters milk. 阿胶阿竹桃仁红花附子干姜 contraindication during pregnancy. 白芷 before bedtime can stimulate the central nerve system. Number 6, temperature. I zoomed, I don't know, I don't see 6. Very warm, 布谷子 very cold, 芒硝天门洞石膏 Huh? Why it's gone? Is it good, Dr. Ho? I only see partially. Number 6.
Oh, yeah, just make it bigger. Sorry.
Oh, I see it. Number 6. Do I have another page to read? I only see one.
That's all. Yeah, that's all. Yeah,
Okay.
because it comes and goes like the different screen. So sometimes
I thought something was wrong.
It's not really convenient. So yeah, continue to do those contraindications. Chunpi, yeah, Chunpi is warm and dry and strongly move the chi in the middle jaw. So yeah, this is dry. So dry cough due to chi or yin deficiency, because strong moving the chi makes the chi more depleted. So that's why chi and yin deficiency, heart phlegm. The Chunpi together the Bansha use urchin tongue, right? So urchin tongue is for rather like a wet and cold phlegm rather than hot phlegm. So, and the dry heat, cough, and blood spitting. Foods true heat force cold. For example, foods used for sini tongue, right? But sometimes patients have the sini sun case, like a liver cheese steak, have a full cold extremities or hand and feet. You may mislead this is a cold, try to use sini tongue. But this is a contraindication because the sini tongue is a kidney and spleen yang deficiency, whereas the sini sun, when do you use the sini sun? What's the difference between sini sun and sini tongue? In terms of the coldness, but yeah, but the main difference in this pattern, right? What's the pattern for the sini sun versus sini tongue? Okay, so sini tongue is used for what? Kidney, so it's like a shao in cold pattern, right? Or kidney, spleen, yang deficiency. The sini sun. Yeah, sini sun. I don't know about like a restricted weight chi, but sini sun is for liver chi stagnation with depressive heat. So this qi stagnation obstruct your gathering qi, zong qi, to spread to the extremities like hand and feet. So, so Sinizan patient have a little bit of yellowish tongue, red tongue like that, versus Sini tongue is cold and the swollen, moisture tongue. But both have could have like a cold hands and feet, so that may confuse the doctors as acupuncturist and prescribe differently. So that's what he meant here. Röntgen, hypertension over 180 systolic, because Röntgen tends to raise up the hypertension if especially like hypertension is very this is type 3 hypertension like that. And Danzao is like a important herb to tonify qi, and the blood is warm but very cloying. So that's why some person with the digestive problem have a lot of dampness. When you take this Danzao, you feel bloated, difficult to digest. So this is so Danzao is be careful of dampness patient, food stagnation, and parasites. Parasites loves this one, and the phlegm. Lurong is antelope horn. A strong, potent of 25 kidney, yang, and essence. The yang aspect of essence strengthens the bone. So yeah, this one also slowly increases the dosage if you give the too high dosage from the beginning and cause a lot of headache and hot sensation. Uwezi is same as shanja. It's soury, so it may cause heartburn. Mianji have some chemical component that damages the stomach, so that when patient has a stomach ulcer or gastritis, then be careful using yuanji. And Dahuang enters the breast, so the channel enters the breast. So that milking mom, usually the milking mom taking the Dahuang, and the child get a diarrhea. So the Dahuang should be avoided with the milking mom, because it enters the milk. And Erju, Taoren, Honghua, Fuzi, Ganjiang. So Erju, Taoren, Honghua is strongly move the blood, invigorate the blood, break the blood. So this is a contraindication during pregnancy. Fuzi, Ganjiang is warm and kind of acrid, so that disperses the fetus, so that is also contraindicated during the pregnancy. Baiji is for headache herb, right? So yang headache, and this is they have tendency to stimulate the central nervous system. So don't take it before the bedtime, like a couple hours before, and take it. For example, like Chuanxiong Cha Tiaosan or headache herb has the Baiji in there. So probably you do take this, but don't take it before the bedtime. And temperature, this is not as because this wasn't on the exam lately, but has before they ask this is very unique, like very warm. What is very warm? It is not hot, it is not warm, it is very warm. So buguji is kind of very warm, using for those like the constipation due to yang deficiency. So with that, and very cold is Mangxiao. There's type of Tiandong, and Shigao is very cold herb. So that's kind of a special category. I mean, special herbs have something unique compared to the others. And the exam likes those special thing, like how to differentiate. That's the questions we had before. Okay. So any questions up now? Not, let's take a break. Okay, yeah, let's take a break. Yeah, see you in 10 minutes around. Okay, let's continue. Vincent, can you hear me? Can you read? Oh, let's see. Yeah, Sherman, can you read this page, please? Yes. Go ahead. Thank you. Right, so this is they did some questions on this section too. So not that many. If you use dangwei, if it is purpose of this dangwei is to move the blood, because dangwei can tonify blood, also they can move the blood. The strong, actually, the depends on the location of the dangwei. So like a dangwei mi, the root of the dangwei is used for more this move the blood, right? Invigorate the blood. And dangwei body is for nourishes the blood. So for you use the dangwei for that purpose, you use you treat with prepare with alcohol. So you put in the dangwei in the alcohol for at least a day and use it. Yanhusu, Yanhusu is another strongly invigorate the blood used for the pain due to blood stasis, and with the salt, that increase the potency because it assists alkaloid to dissolve in the water. So you prepare this yanhusu with the salt that increase the potency. And Bansha Julu, this Bansha Julu is like actually they're using the Wendan tang, and you can add with the, you can prepare with the ginger. It helps to alleviate the nausea and stop vomiting. The salt is guiding things to the kidney. True, because that's why we use the salt, moxa with the salt, that helps, that is useful one. When you inject moxa with the salt, what is it good for? So you mentioned, yeah, this is guiding herb to the kidney. So use moxa with salt. 후보 from message to pin it. What's this? So yeah, you use for this yang collapse. Because as Sherman mentioned, the salt guiding this salt property. So actually the heat from the moxa to the kidney directly. So that gives you like a yang, the yang energy to wake up. This is, yeah, that's what salt is for. And right, yeah, so this property, so like salt goes to kidney, sour goes to liver. So yeah, this is one of the property. Sweet goes to the spleen like that. So yeah, generally those property tells the guiding. Yes, correct. And the Guangdonghua with honey moves the lung to elevate the cough. So yeah, try to memorize these things because probably they get one questions at least from this area. And minimize the side effect. Yeah, bansha with ginger can kind of antagonist or something like that. So usually you prepare with the ginger to detoxify the bansha's toxicity. Okay, and also frying. So frying with a liquid means you can fry with honey is tonifying. The honey is sweet, so it is tonifying like a tree and moisturizing. Okay, honey is tonifying and moisturizing, and with vinegar, astringent. Vinegar is sour, astringent, analgesic. It's relieve pain and invigorate the blood and relieve toxicity. That's why we fry with the vinegar, and frying with the wine, because wine is, they strongly open the blockage because this alcohol content, so they can clear the channel blockage and expels the wind because this is alcohol is light, so it just expels the wind and alleviate the pain. With ginger juice, yeah, any ginger quality kind of helps the bitterness or cold herbs to upset stomach, warm the stomach. That's the formula. Because ginger is probably the best herb to descend the stomach chi. So helping the all those of the nausea, vomit, hiccup, etc. And it's warm, so it protects the cold herbs, damages the stomach. This one. And next page, your herb drug interaction. Okay, Sherman, can you read this page, please? Okay. The mic is not working. Let's see who's next. To see the list. Is Donna here? Can you read?
Can you hear me?
Yes, go ahead.
Okay. 8. Herb drug interaction. 茯苓、当归、和枳麻
Donna,
Yes.
read like this way, left to right, not
Oh,
down.
okay. 茯苓 Lexis 当归口 Medin Warfarin 和子麻 Laxative 白果 NSAID Replace 山楂决明子 Lipito 甘麦大枣汤 Paxil Night taste sweet, tonify, harmonize, sometimes moisten, pungent, acrid, dispraise and move young, blend, space and dram young, sour, astringe and prevent leakage of fluids and energy in bitter, drain and dry in salty, purge and soften in.
Sorry, I clicked the button by mistake. So, can you hear me? Okay, thank you. Let me reset it. I don't like this. Okay. Right. Sorry about that. Let's see. So herb drug interaction. So some herb is contraindicated. Some herb you can replace it because same or similar function. So pulling is already draining the body fluid. Having a lasix together is too much. Dangwei also that Coumadin and warfarin, that's contraindication. Hazema is they can use for the constipation. The laxative is also too much. And Baigo, Baigo is ginkgo, right? So this is contraindication for NSAID. I think they damage the stomach further. And Shanja Juemingzi is used for like a high cholesterol like that, and so that you can replace it, Lipitor. And the Gammai Dazao Tang, this Paxil for antidepressant, you may substitute that. Of course, you cannot substitute yourself, but it has a similar function. Okay, so this you may have to memorize. Oops, thank you. And taste. So sweet taste generally tonify, harmonize, and sometimes moisten like honey, and pungent acrid. This is mostly really 60 herbs. Is disperse and move. Is yang aspect of the tasty. Blend, sips and drain. So that usually used like a fooling is like that, right? And sour, astringent prevent leakage of the fluid and the energy. So the sour property can astringe, so hold the things within the system. And bitter, drain and dry, like a huang huangqi, huangbai, they are draining heat and can be dry. exam. Oh, they have very many different types. So they said like which of the following taste is used for astringent preventive leakage. So you may choose sour. They give sour, sweet, like a blend like that. So yeah, this is typically what they ask. Or like which of the following formula is a similar function of the Paxil? So like amytazoltam. Yeah, something like that. It's common questions. I remember last time on the exam, I think they asked about this Dangwei. Right? So if you improve the potency of the Dangui as you move the blood function, how are you going to prepare? So Dangui with alcohol, salt, like honey, like that. So this is what they can make the questions out of this information. Okay. Next is headache herbs. This is also very commonly asked questions as itself or for modification. So patient has a Taiyang headache, Chiangho, and Gaobon. Gaobon is like a Jane headache, but yeah, they can be used for the Taiyang headache. But the main herb for the Taiyang headache is Qinghao, right? And yeah, but yeah, you also Gaobon using for Taiyang headache because Taiyang goes to vertex as well. And Yangming is Baiji, Gegen, right? Yangming headache. And Shaoyang, Chaihu, Chuanxiong. Okay, Chuanxiong can be any headache, but specifically they go to the liver and Sanjiao channel. And the tie-in headache. So tie-in headache is a patient feels heavy and the feels like your head is squeezing with the wet towels. So you use Changju or Bansha can be added. Zawin headache is Duho. Duho goes to kidney and heart channel. That's like a Xiaoyin channel. And Xiaoyin headache is more likely empty-headedness, kind of dull headache, or like a headache all over and pain radiating to the teeth like that. So that's Xiaoyin headache. And Jane headache is Wuju, Chuanxiong, or Gaobon should be there. But Gaobon is actually not Jane headache because Jane headache, if Jane headache is used as a vertex headache, you can add Gaobon. But Jane headache as the liver and gallbladder channel, Wuju and Chuanxiong. So Gaobon is used for like a vertex headache due to wind cold. Whereas Wuju is used for vertex headache due to liver cold or liver young rising like that. So yeah, both goes to like a vertex, but a little bit different indication in different occasion. And chronic headache, Honghua Taoren, because chronic headache is like a more blood stasis. And wind heat, Manjingji. Manjingji is very unique herb to treat headache due to wind heat. Most of the herb here, like Taiyang, Yangming, Xiaoyang, this is rather wind cold herbs, right? The Manjingji is sort of unique that this headache herb for the heat. Juhua, Sangye, they can help, like bohu, they can also help the headache. But headache as a main function is manjingji. Okay, so that is kind of those are what one-step questions that they may ask on the exam. So you can use this for modification, like as well. Okay. Okay, and let's see, move on to the just one sec. Just one sec. I'm working on another handout. Somehow it's not working. Oh, okay. Let's start. So next section is the dual pair herbs, because a lot of these pair, I mean, many times the herbs are used as a pair to have some synergetic strengths on, the mutually increase their potency. So yeah, pair herb is commonly used practice on making the formula. So usually have a similar functions, but each one they help each other to strengthen the function of the formula. So let's go one by one. This is a lot of a dual. So the first is Ma Huang and Guizi. So Ma Huang and Guizi is used for which formula? Ma Huang and Guizi is used for, right, Guizi Tang. No, actually Ma Huang and Guizi, not Guizi Tang. It's mahwang, right? So, right, the mahwang tang, right? So because this is very effective combination because mahwang is strongly open the pore that they can expel the pathogenic factor. But mahwang is powerful, strong, thick, but they cannot go deeper. Whereas guizi is not as strong as mahwang in terms of like open the pore, but they can go deeper to the muscle layer. So mahwang and guizi together strongly maximize the effect of release exterior going to the muscle layer. Because you catch a cold, usually they attack the channel, and not only the skin, they go to a little bit deeper to the muscle, cause some like a pain in the muscle, right, in the neck and shoulder like that. So mahwang and guizi is a very important combination for that. And mahwang and xingren, next one is also used for mahwang tang, right? Mahwang tang, because mahwang and guizi is used for release exterior, and mahwang and xingren is open the lung passage. So they're like using it as a siphon, because wind cold attack, our body is kind of clogged, right? So everything is condensed because our pore is closed. So mahwang and guizi is open the pore, and like mahwang and xingren is bring this air passage to the lung, so can help the cough and asthma, and making the open the nasal blockage like that. So mahwang tang is what is the pattern for the mahwang tang? What's the difference between mahwang tang versus guizi tang? How can you decide in which occasion you use mahwang tang? Correct, right? No sweating is wind cold attack. This is what whether excess condition of wind cold. Whereas guizi tang is a wind attack. So this is Zhongfeng, and the previous one is Shanghan, right? So a patient has like a chills fever, and the superficial and tight pulse with there's no sweating, high fever like that, use mahwang tang. Whereas the patient has a chills and fever, the superficial and soft pulse with like slightly sweating is guizi tang. So that is the chief difference. Good. And Jingjie Fangfeng. Jingjie Fangfeng is used for dampness, wind cold dampness. So we use this formula is used for Jingfang Baidu. So Jingfang Baidu San is used for like a wind cold with dampness. So the body ache is severe. So you catch a cold, then your whole body ache. So of course you have chills and fever, but your body ache is the main concern. We use Jingfang Baidu San. So Jingfang Baidu San is a variation of the Renshan Baidu San. The Renshan Baidu San is what? Useful? Qi deficiency patient have catch a cold, especially the children. So Renshan Baidu San is a children formula, but the patient has this is also comes as a exam as a modification. Then patient has a chills and fever and the headache and no sweating like that. So they use the Renshan Baidu San, but the whole body is not really disappeared. So how are you going to modify? You don't see any Qi deficiency sign. Then you delete the the Runshan and add Jingjian and Fangfeng. So that's the Jingfang Bailusan. And Jingfang Bailusan, Jingjie Fangfeng is not really warm or cold. So you can, depends on what to use together. You can use wind cold or wind heat. 신이와 창얼즈. So this is a typical nasal obstruction due to wind cold rhinitis. So this is what 창얼즈선. Right? So many times you can use this for the allergy season, especially with this is like a wind cold with nasal obstruction and headache, like a sinus headache like that. You can use the 신이와 창얼즈. It's combination, very important combination for any nasal discharge together with the Baiji, because Baiji also go to Yangming can take care of this the nasal obstruction. Out of Sinihua, Chang'er's Baiji, which one is toxic? Shiniwa Chang'er's. Shiniwa is hairy, so you have to use this for like in the cheesecloth. Chang'er's is one that has the toxic. So if you have overdose of the Chang'er's, you may have some like abdominal pain, distension, nausea, feeling like that. So Chang'er's is a little bit toxic. And as you remember, Baiji is not to not take it before the bedtime, right? Sangye Juha. Sangye Juha is used. This combination is used for which formula? Remember Sangye Juha? Remember Sangjuin? So Sangjuin is used for what? Wind heat pattern with cough and or conjunctivitis. So this is wind heat formula. It's different from wind cold. What's the difference between wind heat and wind cold? Anyone? What's the difference between, what is the main difference between wind heat versus wind cold? So the symptoms, how the symptoms are different. Okay, right. So so wind cold and the wind heat, the similarities both are chills and fever. Of course, the wind heat has more fever than chills, but just they both have chills and fever simultaneously, and they have a superficial course, right? But wind heat, just like wind cold, there's two types, like a Mahuangtang and Guizhitang case. Wind heat also has a two type. This is Sangjuin and Inchaosan. So Sangjuin and Inchaosan. Right. So yeah, pulse is, in terms of pulse, yeah, wind heat is rapid and superficial pulse, whereas wind cold is a superficial with tense pulse for wind cold attack, and the soft pulse for wind cold attack. So yeah, wind cold, the pulse is a bit different between wind cold attack versus wind cold wind attack. Whereas wind heat, yeah, both like a Sangju in Chaosan has both rapid and superficial pulse. Okay? And also the both the wind heat, Sangjuin is more to the lung and the eyes. So cough is the chief complaint of the Sangjuin. So we have like a relative high fever, and cough is main concern. One may have like a red eyes, blood tinged eyes, like a conjunctivitis, itch eyes like that. Whereas in Chaosan is a sore throat is chief complaint. Okay, so Sangju-in is mainly cough and eyes, whereas in Chaosan is for sore throat. So, oops, right throat, correct, yes, thank you. So yeah, this is, so Sangye Jua is for in Chao, Sangju-in. So that's a less severe condition of the wind heat. Okay? So wind heat, the cough, red and painful swollen eyes. And the Gegen Sengma, this is what Sengma Gegen Tang. So yeah, Sengma Gegen is used for like a more superficial and muscle layer, and vent the heat, release exterior wind heat. So this is early stage of measles due to wind heat. Well, like wind cold either way, because this is not much stronger in temperature. So Sengma Gegen is useful, like early stage of measles. Early stage measles is like you kind of some kind of infection, and you have some skin rashes, spread all body, but not evenly. So that is a typical usage of Sengma Gegen Tang. So Gegen Sengma is in combination for skin problem. Jimu Shigao is used for what? This is Baihutang, right? So yeah, Jimu Shigao is used for Baihutang. Baihutang is what? When you use the Baihutang, which pattern you use for Baihutang? Good, yeah, Yangming channel, right? What is the characteristics of Yangming channel? Right, 4 bigs. So big fever, big thirsty, big pulse, and big sweat. So this is key characteristics of Yangming channel. Use Baihutang because this clears the heat in the Yangming, and also like nourishes the body fluid. So Shigao Jimu can clear heat in the Yangming channel and the heat, and also heat in the lung. But Jimu is very versatile herb that they can clear heat, excess heat, or they can clear deficiency heat, and also they nourishes the body fluid. So this is a very important combination because Yangming channel heat, they quickly drains the body fluid. So if it is not fixed immediately, then they turn into Yangming organ heat, right, and constipation. So that's why at this stage, using this Jimu together the Shigao is a very good combination to prevent. Okay, let's see. Okay, there's a couple more. And the Shishin and the Shigao. So Shigao is good for the stomach heat, because Yangming heat. Because Yangming is like a stomach heat in the stomach and the intestine, right? And if there's a heat in the stomach, what is the sign and symptoms of heat in the stomach? It's the stomach fire. If you have a stomach fire, what's the common condition of stomach fire? Right, you have like ulcers, bleeding gums, you're always hungry, and the tooth decay. You have like a gum is rotten, so you have like tooth decay, and the pain, severe pain in the gums. So you use what in this case you use what Qing Wei San, right? Then you use this, but you can add shishin because shishin is warm. Shishin is warm, slightly toxic, but this is very good herb for the toothache. So that's why shishin shigao is a toothache due to stomach fire. You use high dosage of shigao, but a little bit of a shishin helps the stomach toothache due to stomach heat. Okay. And the Jiji and Dandochi. Okay. Jiji can clear heat in the three jaws because it goes to Sanjiao channel, so it can clear the heat from the all three jaws and by urination. And Dandochi is used for wind heat, like a minor case of wind heat, but it depends on how they prepare. They can use wind heat or wind cold. But Jiji and Dandochi both are very important herb for irritability due to heat. So they have like a. So when you at the exam says the patient has like a, let's say indeficiency heat and have a insomnia and irritability is very severe, you use like let's say LUAD11 or something but didn't work, then what are you going to modify? Then you can add like a GG and the Dandochi like that. So this is very effective to clear heat that helps the irritability. Okay, so GG and Dandochi. Right. Any questions so far? Okay, good. So let's take a break. Okay, let's continue. Okay, so yeah. So next tuya is Lugan and Bimalgan. Lugan and Bimalgan. Yeah. This use usually like a clear heat through the urination. So urinary tract infection and the stomach fire. So this is all like a tube-like, so they can clear heat via urination. Mudampi and Danshan. Okay, so both can eliminate the blood stasis and clear heat. So this is another combination for clear in like expels the blood stasis, that blood stasis due to heat. Okay, so this is not used for like a blood stasis due to chi stagnation or yang deficiency. This is the blood stasis due to the heat in the blood, right? So that's why I use it. And the qi xiao, bai xiao, yeah, sometimes they use together because qi xiao, bai xiao, originally there's no differentiation. Oh, can you hear me now? I just saw you a message. Can you hear me? Oh, okay, yeah, good. Yes, qi xiao is more cooler than bai xiao, and they are more effective to clear the helping the blood stasis. So when the pain is due to blood deficiency and blood stasis, we use qi xiao. Whereas when the pain is due to like those chi stagnation, like that, use bai xiao. So sometimes they use together. So blood deficiency with blood stasis, because bai xiao is very effective to nourishes the blood and motion, and also body in, and qi xiao is more clear heat and move the blood. So they use qi xiao and bai xiao together. Huang bai and right, for pain, yeah, the bai xiao is better. So that's the bai xiao is very commonly used for a lot of pain, especially for female. Right? So bai xiao, gan qiao, and the xiao yao san, or like a xiao jian zhong tang, like that. Yeah, bai xiao is very good herb for female due to underlying deficiency. Okay. And huang bai changju is what we use like a miao san. So miao san is this is very simple herb, like just two, changju and huang bai. But this is very effective herb to clear damp heat in the lower jaw, red organ. So, for example, you have a indeficiency, because in the clinic we see many of these indeficiency patients with damp heat in the lower jaw. So it is difficult just use Liu Diwangan because it's too sticky, and you don't want to use like Pingwei like that, it's too warm. So then you use Liu Diwangan plus this Ermiasan together, so that can take care of both. So yeah, to damp it in the lower jaw is very commonly used formula, 二秒三, 三秒三, if you add Niuxi, 四秒三, you add Iran. So make a lot of variations from 二秒. 二 means two. Miao means marvelous, two marvelous, or that can clear damp heat in the lower jaw. And Hangnian Muxiang, this is also commonly used formula for dysenteric tenesmus, so damp heat in the middle jaw and lower jaw. So we use this for Xiao Yao Tang. So yeah, this is Wangnian Muxiang because Wangnian clears the damp heat, strongly clear heat, and the Muxiang is dries, and they dries this dampness. So dryness, tenesmus is all caused by damp heat. You use Wangnian and Muxiang combination. Jin Inhua Lian Chao. Right, the dysenteric is a pus and blood. So dysenteric is the damp heat in the blood. I mean, damp heat in the lower jaw. So dampness makes the pus, or damp and phlegm makes the pus, and the heat makes the blood bleeding. So the dysenteric means the pus and blood in the stool, and you use the Xiao Yao Tang for that. Good. All right. So one question: if there's damp heat in the large intestine, and this damp heat can cause bleeding, right? So blood comes first, or stool comes first? If there's bleeding due to damp heat in the intestine, is blood comes first or stool comes first? Blood? Why? Why blood comes first out of the stool? Yeah, good. Yes. So yeah, that's true. That if the heat ruptures the blood vessel, so that the blood comes bleeding first, right, and then the stool follows. Whereas a spleen Qi deficiency, then that usually stool comes first, and blood following. Okay. Good. All right. So yeah, that's the Xiao Yao Tang. And Jin In Hua Lian Chao. Yeah, this is a very famous formula of what? Jin In Hua Lian Chao San. Lian Chao, Jin In Hua and Lian Chao is the chief herb for which pattern? Which problem? So Jin In Hua and Lian Chao is used the word In Chao San, right? So yeah, this wind heat with sore throat. So yeah, In Chao. So compared to the Sang Sangjuin. Sangjuin is same wind heat, but this is less severe and more focused on the cough and the eye problem. Whereas Inchaosan is more severe and heat and toxic accumulation in the tonsil, have a severe sore throat. So that's wind heat condition. So both are wind heat, but Inchaosan is considered as more severe form, causing a sore throat. Nubangji and Lianchao is both are very effective to the sore throat. Right. Yeah. So Sangjuin is in a less severe form of the wind heat. And the Nubangji Lianchao is these are still good for the sore throat. So you can, this is all wind heat herbs. And Banlangen, Xuanshen is, this is commonly on the exam for modification. So for example, the patient is suffering from wind heat, with severe sore throat. So you use Inchaosan, but still sore throat is not really getting better. Like you have greenish sputum like that, then use Banlangen and Xuanshen. So they are strongly clear the throat, the painful throat, and even like some infections of the throat. And next one, more. And next one is Xuanshen and Muli. Xuanshen and Muli. So this is Xuanshen is also salty property and the cold. And the Muli also dissolve like a phlegm. So this one is the good combination for like this goiter, scrofula on the neck. So this is a neck lump, a nodule. So it's like a xiao luo. Am I correct? Let me check. Right, yes, sorry. Should correct this. So Xiao Luo one is this formula for treat those goiters or scrofula. Mostly in the neck, like a thyroid patient, with Xuanshen Muli and Zhiwei Mu. So this is all can strongly clear the nodules from the neck. Okay? Any questions on this page? So most of this pair is coming from the like a formula, and they are forming the chief herb, chief and deputy of that formula. So this represents the character of that formula. Okay. The next one. will be bigger. Huashi and Ganchao. So Huashi and Ganchao, because Huashi is very slippery and drain damp strongly, so and cold, so it can clear summer heat and dampness. So this is what I use like this two is a formula, right? Liu Yi Sun. So Liu Yi Sun means 6-1. 6-1 formula that you use 6-to-1 ratio, let's say probably 18 to 6 grams of the Huashi and the Ganchao. So Huashi 6 and the Ganchao 3 ratio. Right? So this is for basic formula for the summer heat with a lot of dampness. You can drain dampness and heat, summer heat. 青蒿鳖甲 you use for 青蒿鳖甲汤, right? So 青蒿鳖甲汤 is used for in level heat. So this is Wenbing in level heat. So what is the characteristics of the Wenbing in level heat? How do you know this patient has in level heat? Correct, yes. You're very severe night sweat because in-level heat is that this Wenbing wind heat penetrate from the wave level to chill level to in level. So this in level is a deeper level of the pathogenic influence. So pathogenic factor is entering the in level that patient feels like a high fever at nighttime and a lot of sweat at nighttime. Also looks like some indeficiency sign like the hot flush and the red tongue, no coating like that. And but different from indeficiency to in-level heat is acute excess condition due to pathogenic factor, whereas indeficiency heat is more chronic, right? So more deficiency condition. So that is the main difference. So in-level heat is deep in the in-level. So they use a Qinghao BHA as a combination that Qinghao is very effective herb to vent the heat from the deeper layer, but Qinghao is leaves, so it's very light, cannot go deeper. So that's why they add BHA. BHA is turtle, like a turtle. This dorsal part of the turtle is heavy, right? And the cold, strongly nourish in. So they can bring, BHA brings the Qinghao to the in level, and once they reach the in level, they separate. So Qinghao going out with vent the heat, so they can clear heat at nighttime. And then BHA remain in the in level, nourish in and clear heat. So these two combination is very well formulated to treat heat is in stage, Wenbing stage. Wenbing in stage heat. Okay, so Qinghao BHA tang. And next is a Zimu Huangbai, so indeficiency heat. So what is the most common formula for kidney and liver insufficiency? what formula is commonly used for most famous formula for kidney and liver insufficiency, right? LUAD11, right? If there's insufficient heat, then you modify, right? So we use like a G by D11, right? So this G by is here, like a Jim and Ang by, G by D11. They clear insufficient heat. You may have to differentiate this patient as just insufficiency or insufficiency heat, because sometimes it's quite tricky that this patient has heat or not, because insufficiency has some heat component because of the a deficiency in. So they may have a afternoon tidal fever. They may have a night sweating. They may have a 5-pound heat. So that looks like a heat, but the tongue may be not red. Pulse may be not rapid. So this is just insufficiency rather than insufficiency heat. But the patient has a rapid and steady pulse, and the tongue is red and no coating, and night sweating is rather severe, half flush is severe, then you may think this is heat, deficiency heat, then you can modify to Liu D11 to Zibai D11. So that you may have to differentiate between these two conditions. Steaming bone disease, rather severe form of insufficiency. So you use, right, yeah. So this is like a more like a deficiency fire type, because that's going deeper to the bone, right? And so that's why we either like a Louis D11 versus Jibai D11. Yeah, you use the Jibai D11 is better choice. But you can modify, like you add like in chai hu, like that. And then next is Da Huang and Mang Xiao. Da Huang and Mang Xiao is used for which formula? One of the most famous formula for constipation. What is that? Right, Da Cheng Chi Tang, right? So Da Cheng Chi Tang is used for like Yang Ming organ, right? Yeah, it's just Yang Ming organ. Yeah, it's pretty good, huh? Yeah, I'm amazed. Yes. So yeah, you should be like him. So Yang Ming organ. So remember the Yang Ming channel before? Good. Yeah, I think you're okay. Yeah, I think you should pass. Yeah, you're pretty much of up to the par. So good. So Yang Ming channel is, again, we use like bifurcan, right? So the Shigao and the Jimu. Once the Yang Ming channel, that the heat even deplete the body fluid of the stomach intestine, become Yang Ming organ, and constipation is main complaint. So constipation in this case, Da Cheng Chi Tang is full-blown constipation. You have a Da Huang for hardness, Mang Xiao for dryness, for Jixie distension, and the Popo or fullis. So 다층치탕 양밍 organ pattern has the hardness, dryness, distension, and fullness. And 다층치탕 have these 4 herbs respectively take care of this problem. So this is like a most excess condition of the 양밍 organ. So in this case, still they have a fever, like a sweating and the big pulse, but pulse is not like a 바이후탕 pulse is what? Do you remember the pulse of the 양밍, like a 바이후탕 양밍 channel? So 양밍 channel pulse is surging pulse. So when you remember, like study the pulse, that you see the surging pulse, 홍마이, then usually they are used for this 바이후탕 양밍 channel case. If the 양밍 organ pulse is gonna deep and excess and rapid, because this is deep inside of the lower jaw, so pulse is deep but excess pulse, right, and possibly rapid. The pulse is different. And of course, the constipation is pretty severe. Okay, so that, but it's like the 다황 and 망샤오 are used for the 다층치탕. Next is 다황 and fuzi. So 다황 and fuzi, again, 다황 is very powerful herb to purge the constipation. Sometimes though, but usually that is due to heat, because 다황 is strongly clear heat as well. Not any level, like they can clear heat from the blood level. But sometimes this yang deficiency causes cold accumulation and obstruct the bowel movement. That case, this is a rather like a temporary measure that, I mean, if you cannot poop, it's really suffering. The patient is really suffering from those like constipation. Then you probably use like once or twice, just eliminate those accumulated stool. So using 다황 and fuzi. So two opposite direction of the temp character, like very cold and very hot. But this is effectively warms the lower jaw, so they can move and purge, so they can get rid of the stool. So this is what you call 다황 fuzi-tang. So 다황 fuzi-tang use these 2 herbs, 다황 and fuzi. And next one is 다황, 당귀 and 로총롱. So 로총롱 is like a rather the constipation for chronic constipation, elderly or deficiency. So they basically try to moisturing, warming the yang, and moisturing the intestine and move the qi and the blood. The 당귀 is we know 당귀 used for tonify blood, but also 당귀 is used for slightly moving the blood, and also they use for constipation, and also they use for cough. So 당귀 is very versatile herb, and also like a sage herb for the menstruation for female. So this one is used, this constipation, 당귀 로총롱, we use jichuanjian, used for this chronic constipation, usually elderly or after childbirth deficiency patient. And 타오ren, 싱ren, used for constipation. Both are seeds, and seeds is pretty effective herbs to moisturing, because it's oily nature, make it like a kind of a little greasy, that then the stool can easily coming out of the intestine. So yeah, you use this combination with like a run changwan. Run changwan is like this the intestine is dry out, so you use this moisturing. So run changwan. And next is Mutong and Danjui. Mutong and Danjui. This is for like a mouth sore and the hot heat transfer to the small intestine. So what it tells is that do you remember the pattern of hot fire transmitted to the small intestine and via urination? That is what Dao Qi San, right? So Dao Qi San. Because this one is like this hot fire you can transfer to the small intestine is pair, and that also connects to the bladder is same Taiyang channel, and clear this heat via urination. So this is clear upper jaw heat via urination. So Mutong and Danju is common for that purpose. And Jinajin Haijinsha. The Jinajin Haijinsha, like this Jin is what, like a metal or gold, right? So those herbs names after this Jin can treat the stone. So urinary stone, gallstone, kidney stone, like that. So Jinajin. Again, the Jinajin is also used for those food stagnation, right? We eat as a powder, like 3 to 4.5 gram. It for the food stagnation, it can digest any the food stagnation, and also nourishes the children. And Haijinsha, this is also Jin, right? Sand, metal, from the ocean. So these two, and okay, you can use the Yijin or like Jin Qian Chao. Like, those are the commonly used modification herb. If patient is stone, then you look at those Jin in the name. Okay. And Chumai Bianshu. Chumai Bianshu is acute UTI. Acute UTI, urinary tract infection. UTI is acute urinary tract infection is urgent, burning, painful, frequent, sometimes bleeding urination due to damp heat in the bladder. This is more probably 90% female, not really for male. And the Chumai Bianshu is very the common combination for is take care of the acute urinary tract infection or damp heat in the bladder. So the common formula for the damp heat in the bladder is Ba Zheng San, right? So Ba Zheng San is this is formula for the UTI or damp heat in the bladder. All right. Let's stop here. Okay, let's stop here. So, because knowing this combination, kind of what is the main herb or the formula, because this formula is most of them is your board formula, so you should know this formula well. Okay, so it's kind of, before we go to formula, we go do some review together with herb. And this Duyao is very commonly show up on the exam as a modification. Okay? Any questions so far? Yeah, I did. It is in urban, I guess. No? Oh, you don't have it? Okay, let me check. If not, yeah, I'll email you. Okay, sorry about that. I thought I sent it. So you have the like a first part, right? But not this the 3 hour part, right? Oh, all right. Yeah. Okay. Sorry about that. Yeah, I'll send it. So. Okay, thank you. Yeah. Okay, thank you. So I'll see you next week. Hopefully the Moodle is gonna work in next week. Have a nice weekend. All right. Thank you. Bye bye.